So I think you should interview a therapist. You should reach out and you should set up a time to talk to them, or at least email them and ask them some questions. I'm wondering if you all have noticed any gaps that are really evident in the field of therapy in terms of our practical skills.
I would say specialized training.
Yeah.
Right. I think, we are trained more often than not to be more generalists. And when people don't seek out that extra training to be more specialized, particularly in, some of our really interesting kind of like symptoms and disorders and things of that nature. So that's where I see some of the gaps. Not always, right? But I'm definitely seeing people treat people that they probably shouldn't treat, but outside of their scope of practice.
Stay within your scope of practice. And to your point, so like I've also gone for certifications, so I have my certificate in advanced alcohol and drug counseling. So I did that. I'm pursuing health, nutrition, and mental health and nutrition. So because I look at the whole person,
Right.
So I'm dealing with that. And so it is necessary for us to do specialized care. And it is a great feat to get your PhD, your doctorate, and all of that. It really is.
Absolutely.
And we should celebrate one another for that. However, to Candice's point, we do need specialized training.
We see in the school side, there's a hesitation to get knowledge about some of the specialty areas because we don't do therapy in schools, we don't diagnose, we don't dig into a lot of deeper issues. There's almost the sense of, is it a liability if I know this information, right? Like in a school setting, we do have to be careful because we're not going to cross that line, but there's so much value in having knowledge and understanding what a student is going through, what their family is going through, that I think it would be so beneficial to have more knowledge about more issues, to have alcohol specialty information.
Right.
Again, not that we're going to be treating students that have alcohol issues, but imagine how empowering it is if a school counselor has that knowledge. How much more are they going to be able to support that student and make sure that they get connected to the community resources?
Right.
We don't want to diagnose, and we shouldn't diagnose, but that doesn't mean that we can't know about the diagnoses.
That goes back to your point again, Leigh, about education,
Yes.
because it's needed to make those connections.
Absolutely.
Not necessarily to do your specific job as a school counselor. However, if I have the knowledge, I can direct them to the proper, specialty,
Absolutely.
the person with that specialty.
Yes. And I think sometimes we forget that part of our role as a counselor is to make those referrals, to do that consultation, that can be as important as providing that individual, that group counseling.
So we're talking about this training, right? And at least I noticed, that gap there. But what can we do, particularly since we're all professors, as also, clinicians, practicing clinicians, like what can we do to make sure that professors and clinicians can work together to bridge theory and real world practice?
Well, to start, I think Capella does a really good job with that. I honestly do. With many of our professors are practicing clinicians. And so we do bring that into the classroom. We bring that into our course room. We bring that to residency. We bring that to our internship. And so creating that connection. And I love this conversation that we're having right now, to Leigh's point, so maybe that's an area that we can start, bringing more energy to as far as school counselors. How about, letting them know that this is a specialty, not necessarily for you to, advise, but to connect, creating those connections,
Right.
Right. Yeah. Our in-person residencies are by far what I think helps connect the theoretical to the practical, right? And then after that, our year-long internship where I'm spending, 10, 12 hours a week on Zoom with students, and we're watching tapes of them in the therapy room. And we're stopping down and I'm asking them, why did you do this? Why did you not do that? What do you think about this? And so I'm there as a coach helping guide them. So I think that we need more of that. And that's unique, I think, to what we do here.
Yeah.
Yeah.
So I'm curious, you all, I think, have mentioned a couple times, like people saying, do you know a good therapist? What advice would you give to someone about how to find a good therapist or a good counselor?
I think I might ask someone, what is your desired outcome for therapy? And then that will help you to know who to reach out to. So some therapists are more emotionally focused. Some are more focused on cognitive thinking, what your thoughts are. Some are more behavioral. So I think you should interview a therapist. You should reach out and you should set up a time to talk to them, or at least email them and ask them some questions. I know that people do that in my practice, and I think they're the consumer, they're the customer. So I think you should see yourself in that way. Yeah.
That's good advice. Interview.
Right.
Interview.
So what does that interview look like?
So where did you go to school?
Yeah.
What have your training been? What does therapy look like? How long is therapy? Will I have to lay on it? Believe this or not, will I have to lay on the couch?
Yeah.
Right?
No, you don't. But
Right.
yes, I have been interviewed. What is my approach? What is my style? Definitely how long I have been providing therapy. How long have I been married? Do I have children? Because they want to know, like, if you're giving me advice in this area, are you the same? So it's been more of them wanting to, I guess maybe wanting to see if I'll be a good fit.
Sure.
Yeah.
Because they're not asking more, more of my credentials, but like me as a person.
For sure.
So they want to know
And your
that.
style. And,
Yeah.
Yeah.
And spirituality.
Mm-hmm.
So I get a lot of that.
Well, I think we see about, in our ethics and we teach about, we don't want to disclose too much about our personal information. But you mentioned, potential clients asking you about your own marriage and your spiritual take on things and your values. How do you navigate that space?
I asked them, tell me, why is it important for you to know that information? That's a good question, I think. Or how will it be helpful to you to know that information? And then that lets me know kind of what's leading that.
And for those who, don't, who are asking those questions and they think that, it's not that big of a deal. And sometimes it isn't. I just want to make sure that the focus is on our clients, right? And not on us, because I don't want there to be comparison, right? Like, okay, well, she's not married, or she is married. And so is she going to be able to help me? Or, she looks younger than, who I think she should, or how old she should be, right? And so I think that, it allows for us to really turn it back on the client, and then instead of giving the focus on us,
Absolutely. Absolutely. So, well, tell me this. How would you define a successful therapy? What would you say to that? What is successful therapy? How do you know you're being successful in therapy?
I think that's a great question. It goes back to me, and again, thinking about my context of being in a school setting and working with kiddos, is understanding what they're trying to achieve. And with students, sometimes we have to help them identify, like, what is your goal? What are we trying to figure out? Are we trying to figure out how to navigate conflict with friends? Are we trying to figure out how to control behavior? Are we trying to figure out how to manage anxiety? And setting achievable goals, and working with our students or our clients and identifying what those goals are. And so from my end, it's meeting the goals that the clients or students are setting for themselves. And to me, that's success. It's not about me achieving anything, but it's about making sure that the client, the student, is meeting the goal that they have for our time together.
Yeah, I think it's a couple, I agree with that. It's outcome based on the goal. Also, I think in some of my cases where we're just their emotional regulation skills are on point. They're able to come in and they're talking about what's happening in their lives, but they're remaining steady, and they're not having the highs and lows that some of my clients might have, or they're actually ahead of me in terms of things I might ask or say, right? So it's the conversation shifts to more of a the dialogue's just different. I feel like, I don't know if you all notice that or not, but when I feel like it's time to back off on the frequency of our sessions, it's because of that.
Yeah.
Right?
And I have a measurement for that.
Oh, do you? Okay, great.
When they come in and they say, oh, I was out and I was confronted and I thought, what would Dr. Candice do? She would have told me to do this. How would handle? That's success to me. Like when they start coming in, they was like, I was thinking about you, and I was like, what would Dr. Cleo say about this?
I love that.
Yeah.
That's my measurement.
Yeah, that's a great one. That's a great one. Because I'll say, that's not me, that's you. You know what I mean? And I allow them to divine their success on their own. And so that's actually one of the questions that I ask in the very beginning of treatment. It's like, how will you know? You know, when therapy is all said and done, how will you know? What would it look like for you? Because success is not perfection, right? It's about how you're able to manage and regulate, you know, all those things that you were struggling with before. And even if something new comes up, you still have the skills, those learned skills, to be able to handle, you know, whatever might be coming at you, right? Because we will still experience crisis, regardless of, you know, being in therapy or not.
Yep.
So what do you all think takes a therapist, the soft skills that takes a therapist from good to great? What moves the needle from that's a good therapist, now here's a really great therapist?
That's a great question. From
I
good
think it
to
goes
great.
to the connection,
Okay,
right?
yeah.
You know, and being human. And I'm only going to be able to speak from my perspective and what I've heard from clients, or whether they're talking or referring to me or other, you know, clinicians that I've worked with. You know, the idea that, like, I just connect with you. Like, you get me, you understand me, you know, you met me where I was, right? You weren't rigid and, you know, made me feel like less than. I think it's really about that connection of, like, and you were talking about that connection a lot, Cleo. Just like how the client felt safe in a particular space, right? And not just like someone that's just like doing something very rigidly or by the book. You know what I mean?
Right.
But connecting with them.
Yeah. And I liked how you described connection. You said connection, but all of those other soft skills is what made the difference. Not being rigid.
Right.
You know, being relaxed in your approach, being compassionate.
Right.
you
Right.
know,
Yeah.
and that's something we can't really teach. We can teach intervention techniques and all of that,
Sure.
but we have to really push our interns. You have to have compassion. You have to get that from inside yourself. The compassion, the empathy, and that's what I drive. You know, and when a therapist can drive that compassion, I think it moves them from being good to great. Because this is my personal belief. People don't care how much you know till they know how much you care.
Ooh, I like that one.
Absolutely. Yep.
Can you repeat that? Because that was a good one.
People don't care how much you know
Yeah.
till they know how much you care.
Yeah. Oh, that's good.
Yeah. I think along those lines, as you both were talking, I was thinking like a space free from judgment,
Yes.
you know, and how we communicate that they're okay. You know, when people come to therapy, they're feeling vulnerable and they're feeling like, you know, they're not their best self, right? That's why they're there. And that we have created a space where it's okay and we're not judging them and we're not, you know, devaluing them. I talk a lot about with my students, you know, giving grace. One for themselves,
Yes.
right? We give a lot of grace. I tell them I give them grace because I need grace, like as their instructor, as their professor, you know. So it's
Absolutely.
it's assuming, you know, you're doing the very best you can in this moment in time, and I'm here to walk alongside you so that the next time you can do a little bit better, you know. And I think that they pick up on that when you're really genuine about that. They know. And that makes a huge difference.
Yeah. I like that a lot because, you know, it's just making me reflect on some of the work that I've done with clients and just recognizing like, okay, yeah, it was about that care. It was about that, you know, compassion. So what are some of those, you know, most important skills that you teach in your classroom?
Not knowing.
Yeah.
Oh, yeah.
Not knowing, yeah. Having a beginner's mind, taking a not knowing stance. suspending your preconceived notions and your own story about what you think might be happening with the client. Yeah.
Yep. And definitely back to what Leigh was saying, be your authentic self. You know, you can't be anyone else. You know, be a first class you and not a second class somebody else.
Well, you keep dropping these gems,
I tell you
Cleo.
what, that's a good one.
Oh my gosh,
Yes,
that's
so
good.
bring your authentic self to the therapy room.
Yeah.
That's what I tell my interns.
Yeah, and be curious.
Yes.
Right. You know, I think that that's what people forget, right? While we are trying to help, we're not trying to solve people's problems. We want to walk alongside them so they can figure that out on their own. But being curious, because I don't think we're curious enough.
Okay, so we know we've done this a long time. We know that this is counseling thing is not easy.
Right.
You know, we sit with people in their very, very difficult times in their life. What do you think, as practitioners, as counselor educators, what's the most challenging part of this work?
Sometimes I'm sitting there and I know exactly what they need to do, but I have to wait till they're ready. You know, I can't fix it.
Yeah.
It's very challenging for me. I'm
No,
Mama
I
Bear.
agree.
Yeah.
You know, I want, like, just do this, you'll be fine.
Right.
And I can't.
Especially if you've seen that, problem repeatedly
Yes.
with clients, right?
I would say not giving away all of my empathy, which may sound interesting because I have to have some of that for my own personal relationships as well. So at the end of the day, I have to still go home and, be with my
Right.
family and be
Right.
and
Right.
listen to what's happened in their world for the day and still have something to give.
Something to give.
Because if I give it all away all day long, then my own personal relationships will suffer,
Yes,
right?
Gonna
one
still
hundred
never-
percent.
Yeah.
Yeah.
So that's probably the most challenging, is knowing where that line is.
Yeah.
Yeah.
That's good.
Absolutely.
How do you know where that line is?
Yeah. I think for me, it's when I'm working harder than the client, when I'm feeling the need to solve the problem,
Yeah.
right? When I am, when I'm thinking about my client as I'm driving home, I have to okay, hang on a minute. It's time for me to close the folder and put that away for a week, right? So I think that's when I'm caring beyond the point of my job. It is
Yeah.
a job, what we do. We love what we do.
For sure.
Yeah.
Right? But it is, at the end of the day, is our career. So we have to have those clear boundaries, I think, between personal and professional, for sure. On that note, I'm wondering, how do you balance emotional validation and personal responsibility with clients?
Great question.
Yeah, great question. Well, I don't pretend and I'm not fake. If they're doing well, I'm going to let them know. I'm going to build them up. I'm going to be that cheerleader. However, they need to be responsible for their own change. I can't do it for them. I can't do your homework for you. You have to do that if you want the change. Let's go over our treatment plan again.
Right.
Let's go over the goals.
Right.
What have you accomplished?
Right.
What do you need to accomplish?
Yeah.
Yeah. Is this moving you toward your goals, or is this maybe keeping you from getting that?
Absolutely.
And I think that's the line. If we're getting closer to your goals, then I think that's where that validation comes in. If it's keeping you from the goals, I think that's where helping them to take responsibility.
Right.
Like that's where that has to step
that
in.
line, yes. I'm asked all the time when I tell people where I work. I work for Capella. I'm a professor here. They're like, "Oh, do you like it? How do you like it? What do you?" I say, "I love it. I love working with Capella. I love what they do. How they their innovation with the students and how they merge. I guess they blend the practical with the theory." And we see that with our residency. We see that with internship. When we're at residency, we spend the first 5 weeks with our students on virtual. And then what we're teaching them virtual about micro skills, how to engage their clients, that therapeutic alliance, building that. And then they come into the residency, and in person, we're helping them flesh that out. This is what it looks like. This is how you act. This is how you engage a client. These are the facial expressions. This is how you lean into them. This is how your tone, your pace, all of that matters.
So when we talk about holding on to the traditional ways that marriage and family therapy students have been educated in our field, reflecting team, that's just basically where everyone is we're reflecting back to the client if we can. Not always possible, so I'll just use it for the therapist, but we're bringing that forward. We're bringing the same what would have been on the ground training, and we're putting it online. That's what we're doing. So we're holding on to the traditional way that MFT educators have taught their students. We're bringing it online through Zoom and through a lot of other platforms we have here at Capella. So that's that's really the way I do it. And then we all can communicate. What I love too is the diversity. We're all over the country.
Yes.
We have so much diversity, and that brings so much creativity and different ways of doing therapy into the room.
Yeah.
So
Yeah. And diversity across fields.
Correct. Right? Yeah. So being able to be here with all of you, right, is really great. And I've worked at a handful of institutions over the years, and they're typically brick and mortar. So this is my first time being in an online program, and so it took some getting used to, right? Yeah. But what I really appreciated is just the commitment to the development of these students, right? With us being a CACREP, more specifically to counseling, a CACREP accredited program, meaning that we have the gold standard as a counseling program to be able to provide this education, and that we're producing students that are really going to be, committed to supporting clients who really need that help. And so just being an online program did not hinder that, right? Because we do have our things like our residency programs or, our synchronous meetings with internship and things of that nature. So I really like how we can continue to grow, right? The diversity is huge, not just with the students that we're working with, but also with the faculty,
Sure.
right? And I really just love being able to learn so much from so many different folks and seeing so many faculty members who have gone on and done like really incredible work.
Yes.
I like to call them like celebrities.
Not terribly long ago, we were in a leadership meeting, and we were challenged to think about, particularly for school counselors, like how can we better collaborate with other stakeholders that school counselors work with, not just counseling folks, not just our clinical mental health partners or community mental health partners, but other educators. And it was so exciting to be a part of that and to be encouraged to think like, let's do it. Let's get some meetings together. Let's get folks around the virtual table and let's talk about this, because this is what our students need, our Capella students need, but also thinking about the students that they're going to serve. Like that's what those kids need too.